Welcome. My name is Andrew Hall. I am a PhD chemist with a focus on natural products drug discovery. My main focus has been in cannabis and psychedelic research. Today, I will be talking to Rayyan Zafar, who is a doctoral level researcher out of the Imperial College of London Center for Psychedelic Research and Neuropharmacology. Rayyan is truly one of the most well-rounded scientists I have ever met in this emerging psychedelic field. We were invited by Design Miami to have this conversation as part of this show's Humankind theme. Today's talk, titled The Psychedelic Renaissance, focuses a lot of today's core values of healing the world through natural medicine. Without further ado, Rayyan, would it be okay if I ask you a few questions?
Yeah, sure. Go for it, Andrew.
First topic I would like to cover is, what do you think the key differences are with what you are seeing now versus the olden days of psychedelics and psychedelic research?
Yeah, interesting question. So I guess the start of the psychedelic research in the 40s and 50s actually started in a lab in Switzerland, Sandoz Pharmaceuticals, who created LSD. And during that time, actually, a lot of the world's LSD was actually apprehended by the CIA, who conducted a secret covert mission, which was named Project MK Ultra. And the design for that kind of project was in order to try to change the minds of communists such as Fidel Castro or individuals that weren't aligned to the political belief systems in the US. And so actually LSD and psilocybin was unwittingly used on prisoners of war, members of the public, to try to change their perception. So had a little bit of a nefarious beginning. And then in the 60s, it kind of trickled into universities such as Harvard, where Timothy Leary led a movement, and his movement was also twinned with sort of the initial psychedelic era. But after this, it was banned, and there was a 50-year period where there was practically no research in psychedelics at all. And that was up until 2010, when groups like mine at Imperial College and others at Johns Hopkins started to really try to go back to those original roots and unpick not only the clinical benefits of psychedelics, so how they can treat many psychiatric and mental health conditions, but also trying to unpick the brain imaging and trying to understand how these substances are working on the mind. And so that's the key difference, I'd say, between that early research and now, is that we've got better tools such as neuroimaging that we can really kind of get under the hood and see how these drugs are causing their effects.
So what do you think that the key difference is between the current renaissance of psychedelics when it comes to not only the formulations, but also what is the key differences with psychedelic assisted therapy?
Sure. So I guess right now, the current formulations that are in clinical trials are all called analogs. So you have psilocybin, which is the breakdown product of from the magic mushroom plant. And many companies are trying to emulate this molecule and patent it. And there's some clinical trials being run with that at the moment. But also, as well as that, right now, you have this kind of second wind of research emerging called second generation psychedelics. And these are quite interesting compounds. So these are building on those structures such as MDMA molecules, ketamine molecules, or the psilocybin molecules I mentioned, and kind of adapting them slightly with chemical sort of compositions to try to change the duration of effects, try to make them more niche and targeted. So that's an advancement in medicinal chemistry that's happened from this development. And then with the psychedelic assisted psychotherapy, it's really important to know that we don't just give individuals drugs. There's a therapeutic setting which is kind of cushioned around and within the actual delivery of the dosing. So we have something called a preparation session, which comes before you take the dose. And this is where you sit with a psychotherapist. You talk about issues related to why you may be suffering. And then during the session, you have support of guides who will help to guide you through the process and help if anything comes up to the surface. And then probably quite importantly is you have an integration session, which usually happens a day after the dosing. And that integration session allows you to take sort of insights from the experience that you've had and try to understand what they mean and how they could help to, help you to rebuild your life.
Help process a lot of the issues and trauma that I think we go through on a day-to-day and yearly basis, I think.
Yeah, exactly.
So when we talk about traditional drug discovery, I think medicinal chemistry gets so obsessed with targets. So can you talk a little bit more about, say the 5-HT receptor? This has long been understood as a possible therapeutic target for Alzheimer's, and what is going on in some of the neurochemistry associated with some of these psychedelics, and how are they acting within the brain?
Sure. So the brain is a chemical organ to begin with. So the way that we feel emotion or the way that we engage with behavior is through the release of these chemicals in the brain. And we call them neurotransmitters. And so you have one called serotonin. And so serotonin is released under certain circumstances, important in mood regulation and behavior. And it's implicated in psychiatric disorders like depression. And so psilocybin, or magic mushrooms, the active ingredient, as well as LSD and DMT, which we call the classic psychedelics, they bind to a specific serotonin receptor called the serotonin 2A receptor. And that's ubiquitous in the brain. And it's actually most abundantly expressed in something called the neocortex. So that's the most evolved part of the human brain. So it's this front part of the brain over here involved in executive control and cognition. And actually, we think that psilocybin works by engaging with these receptors in the brain, because we know that if we block those receptors with other drugs, then we don't get hallucinogenic effects in individuals. So we know that that receptor, the serotonin 2A receptor, is fundamental in mediating a psychedelic effect for individuals.
Super neat. Can we talk a little bit more about, say, microdosing? I've heard some implications of heart-related problems, or how do you mitigate some of these issues associated with some of the uses, whether or not it's recreational or, truly medicinal, which is what we're after, within, the drug development market as well as recreational.
Cool. So I guess there's not much research actually out there at the moment which looks at the side effects of microdosing. And one possible side effect of it could be an interaction with another serotonin receptor called the serotonin 2B receptor. So this is different from the 2A receptor, which I mentioned before. So the 2B one sits on the heart. And it's unclear whether taking a microdose, which involves maybe 3 or 4 ingestions of a very small subperceptual dose of psilocybin or LSD a week, whether that has an effect on the heart. And I guess we need to do studies to look into that in further detail before we come up with a conclusive answer. There's other psychedelics as well, non-classical ones like ibogaine, which could have some cardiac toxicity to it as well, which also need to be looked at. But I think in careful clinical settings, under the supervision of a doctor, these kinds of risks can be mitigated and they can be considered. And so it's actually quite important that this research happens so that we're fully aware. And I just want to finish by saying that, all medicines come with a slight risk, and it's about the benefit to risk ratio that a physician actually uses when making the decision to prescribe. So we need to be aware of the risks for sure, but we also need to be aware of the benefits at the same time.
So I think there's always risk, and I think the Imperial College of London has done a good job at changing some policies with some of the recreational use as far as clubs. Can you elaborate more what policy work you guys have done as far as the social impact from, say, recreational clubs and the party scene per se?
Yeah, so that was actually through Drug Science, which is affiliated with Imperial, through Professor David Nutt. So this is a policy chamber in the UK which sets out legislation to try to bring about harm reduction and change policy. And in particularly with harm reduction, one of the things that we're quite vocal about is stuff related to raving. So, for example, you see an increase in women going up to A&E departments after raving and taking MDMA or Molly. Actually, research has shown that this could be related to levels of estrogen, which is a female sex hormone, and it's more highly expressed in females than males, and it causes individuals to hold on to water in their body naturally. And so when these females have MDMA, for example, or Molly, they hold on to even more water in their body. And actually what that can do is it can cause swelling of the brain, which is known as edema. And, in the most serious circumstances, that could lead to coma. Having clear messaging about how much water to take whilst raving is key. And then also encouraging venues to also be well ventilated and be able to provide free water as well to ravers is also essential to reduce harms. And actually, since this messaging has come out, a lot of venues are taking note of it, and actually they want their best for their customers too. So yeah, I think it's been a really positive impact in terms of that.
So it's a lot of research, education, and really understanding of really the clinical significance of a lot of these compounds. Is that pretty much what you're feeling?
Sure. Yeah, it's taking science, I guess, from that angle and then bringing it right through to public health, which is key.
Yeah. So what do you see typically? So what pharma companies, what are they doing differently within this psychedelic science? And what are some of the indications that you see them looking for as far as the medicinal benefits of these things?
Sure. So right now, there's lots of clinical trials going on across the world, and actually quite differently. The companies that are taking these up are not big pharma, so not your Pfizer's or your Janssen's or GSK. It's small biotech firms which have emerged. So, namely, one of the key ones at the front at the moment is Compass Pathways, who just released their results on a phase 2b study in treatment-resistant depression. So these are individuals that don't respond to conventional antidepressants, and they actually found that psilocybin was successful at reducing depression in these patients that would otherwise not have responded to normal antidepressants. So that's one area which is key. There's around over 300 million people in the world with depression, so it's a key area to target. And then the second kind of major area is also addiction. So you have around 160, 170 million people in the world, and addiction medicines are amongst the lowest in effectiveness at the moment. And so there's a massive treatment gap between the people who are suffering and going into remission versus what they can actually achieve. And so psilocybin has been shown in early results to be quite promising, and some universities such as Imperial and Johns Hopkins and NYU are looking into how psychedelics such as psilocybin may be beneficial to individuals with addiction. And then outside of those two categories, broadly speaking, there's ongoing studies here at Imperial in anorexia nervosa, OCD, chronic pain, to name a few. And we've got plans, like I mentioned, to introduce an addiction study in the near future.
Super cool. Just as a chemist and medicinal chemist, when you look at this chemistry and the implications of these beautiful natural molecules, it seems like there's so much research utility that needs to go on with them. How is much of your research actually taken care of and funded at the Imperial College of London? I know I've had some hard time finding some funding for my startup in psychedelics. So how does Imperial College challenge it as address that challenge, being pretty much the world leaders in psychedelic research?
Sure. I mean, it's practically impossible still in the UK to receive government grants for any psychedelic research. And that's not just in the UK, it's in the US as well. We received one MRC, which is a government grant, several years ago. But the bulk of our money comes from philanthropists, so individuals who support the psychedelic movement and believe in it. A lot of the money comes from donors as gifts. And so we also have some collaborations with companies, but mainly because we don't want to be kind of simied to a company or be seen as being preferential to anyone. We like to accept donations. So we're definitely very much open to receiving donations from individuals who may be interested in supporting our line of research, which is essentially fundamental research, which kind of brought about, the movement of the psychedelic renaissance, actually.
I totally agree. I think a lot of the academic level research really uncovers the true therapeutic potentials of a lot of molecules, and it's very well underfunded because a lot of investment firms don't really see the potential without direct research a lot of the time. I think it's very critical, and it's very cool as we, work with ITER and some of these other things to see what is going on. And I feel like we're at the beginning of the big wave of this industry per se. Thank you, today's guests, for taking the time to listen to us. I would really like to thank Design Miami for inviting us to help educate the public on this psychedelic renaissance, and would really like to thank Rayyan Zafar, who is truly one of the most inspirational researchers that I've met in this industry. And I think he will be at the top and forefront of this research pillar as we move forward.
Thank you, Andre.